have to ask your permission for use this video for educational purpose on internet.
Yes,
Do I have your
that's
permission?
fine.
Good. Now tell me about your symptoms in the neck, just in the neck before the surgery.
Before the surgery, the neck, I had severe pain way in the back, and then of course it would go up the neck a little bit and then down through the shoulders.
That pain was really bad, right?
Yep.
And for years.
Yep.
How
And-
bad was it?
I want to say it was probably 2 years before I came to see you.
Yeah. And 1 to 10, how bad was it?
Oh,
It's a 9.
9.
sometimes it would go from 7 to 9.
Yeah. And your problem was not an easy one. And this is testimonial about what we did. We did what we call anterior cervical discectomy and fusion, but your bone was growing in all the levels here. Look at that. The only level that your bone was not growing was the problem. And the question was, how do we stabilize that level that was not growing? And the problem is because all the other levels are growing, that's the only level that moves, that get very stressed. And most of the time, many of my colleagues think, you have to go from the front and back or go many levels above and below. And those are all good options.
Okay.
But we decided instead of going from the front and back, to put 2 plates, not 1, but 2 plates, and more than just 2 screws. Like you got 6 screws here
Yeah.
to stabilize it. And that sort of enabled us to do that surgery in shorter period of time, not to go from the back, because back, it can be high risk for infection. Do you remember the surgery?
Yep,
How long did you stay in the hospital?
one night.
Just one night.
One night.
And we didn't have to open it from the back. We did it all from the
All
front.
you did all from
And
the front.
it's
right,
actually
right there,
healing
right
pretty
in
well.
the crease there.
It's barely visible.
Yeah,
How's the pain now?
good.
In the neck,
Good.
pain gone?
Yeah.
That pain was
Well,
gone?
it gets uncomfortable sometimes.
Yeah. Mm-hmm.
I can tell when the weather changes, barometric pressure changes,
Yeah.
then I can feel that.
As well, I can tell that when you start moving it a lot, it may give you some limitation because your neck is all
Yeah.
growing. It's look at that, all the way from bottom to the C2, we say, all the bones are growing. So there's really, your neck doesn't have any natural movement anymore. And if you try to do too
Yeah.
much, that might become uncomfortable. But right now, you're telling me your pain is 0 today. Is that
Zero
right?
today, right? Right
Okay.
today, like I said, I'm sure this is muscle or
Yeah.
nerves that are sore, not necessarily the neck. That would be correct?
Yeah,
Yeah,
No,
because-
that sharp pain that you had for 2 years before the surgery, that is gone.
That is gone.
That
Yeah,
is gone.
That is gone.
The limitation, your limitation is now coming from that your spine is already growing together. But even considering, look at that, that's another important thing. Even though all the other levels are growing, practically the only thing what's left is the motion between the skull and the C2, we call it. And even there is quite arthrosis there. You still can move your neck to a good amount. Can you try to do
I can go up and down,
and then
and
side
I
to
can go
side
this way,
and the other
and I
side?
can go this way,
That's pretty-
but I can't go like this.
Yeah, and that
That there,
You
Because
have a
the
little
bone-
Very
trouble
soft.
looking to the left.
yeah,
Yeah.
the left side really bothers me.
yeah, because your bones are all growing together. Not even where we did the surgery; they are growing by themselves together. But your daily activity, are you okay with your daily activity? Are you?
Yes, I can shovel. I can.
Shovel.
I can shovel. I
don't
wear
want
the
you to
brace
shovel.
sometimes though, but
Yeah.
I can shovel. I use a snowblower
Okay.
when I have to.
So,
but I can
you-
rake the yard and do stuff like that.
This is something what my patient asked me. If you fuse my neck, how much motion am I losing? You have a natural fusion in your neck all the way in almost all the levels, and you still are able to do daily activity. And the only level that wasn't growing together, actually, that was the level that was giving you pain, and that we fixed. So, and you still are able to do daily activity. So, this is the answer to my patient who asked me, if you fuse one level or another, how much motion am I losing? The answer to that is very little, because
Minimal.
there was really nothing to start with there.
No.
Overall, happy with the results so far?
So far I am. Yep,
Excellent.
so
Well-
far I am. One question: what causes the fusion, and
fusion?
why? And I'm sure when I fell and hit my head, that's what broke it apart.
It was growing together. When you fell, you broke that level that we fixed. And the answer to that is unfortunately aging.
Aging. Okay.
Most of the time, some genetic factor, but mostly aging.
Okay.
Okay. Well, thank you so much for the interview.
You think?